In today's session, I will try to elaborate the zoonotic diseases. Let's understand what is zoonosis. The word zoo stands for an animal. So, basically, zoonosis is a phenomenon wherein certain diseases are transmitted from animals to human beings. Now, mind well, they may not be so serious in the animals where they survive. The pathogens, virus, bacteria, protozoans, or other parasites, or maybe fungi. Wherever they are present initially, they may not be so seriously harmful for those animals. But when they are transmitted into humans, they may turn out to be deadly. They may turn out to be dreadful. So, this kind of transmission of infections, pathogenic invasions from animals to human beings is called as zoonosis. And the diseases transmitted in this manner, they are called as zoonotic diseases. Zoonotic diseases. As I said, these could be bacterial, viral, protozoan, helminthic, fungal, or any other parasitic. Further, the transmission can be through direct communication, that is through direct contact, or through food or water. Now, when I say food or water, it could be through water or it could be consumption of meat. Infected animal, if that meat is consumed by human being, it could be transmitted to humans. So, transmission could be through food, water, or other means, even through environment. HIV. Now, HIV is known to all of us as a disease which has originated from apes and have been found to be dreadful for human beings. For last few decades, we are trying to find a solution for it, yet we are looking for some concrete solution to come out for HIV. So, HIV could be one. Another disease that's probably known to us is Ebola. Ebola, pathogen that harms the nerve cells or the brain cells. And the recent one, that is COVID-19, that is coronavirus. That has also originated from bat, as it is learnt, and has led to a havoc for human beings, a global pandemic. So, as I said, in this session, I will try to elaborate certain specific diseases such as bird flu, that is H5N1, anthrax, rabies, and toxoplasmosis. First of all, we will talk about bird flu. That is an infection which is transmitted from birds to humans. And it's a kind of influenza type virus that causes the infection. It is identified as AH5N1. AH5N1 because it is an Asian variant that is known to get transmitted to humans. So it is AH5N1. Just like flu, it will be transmitted from birds to humans, but it is not known to be transmitted from human to human. Human to human transmission is not recorded so far. The first case of H5N1 infection was reported in 1997 from Hong Kong, and later on it was transmitted to quite a few humans. The thing is, mortality rate has been found to be remarkably high. Almost 60% of infected people have either resulted into complications or some of them have even died. So mortality rate is known to be very high. Now, how do we understand whether it's bird flu or what? That is, what symptoms? Commonly, as I said, it's a bird flu. So flu-like symptoms. There will be running nose, there will be cough, there will be drowsiness, diarrhea is there, fever is there, some respiratory difficulty could be observed, headache would be there, muscle ache might be there, some similar symptoms could be seen. And if it's not identified and treated in time, it may result into complications that would include sepsis, severity of infection, leading to pneumonia or organ failure, or at times respiratory distress. Respiratory distress can result into further complications. So it needs to be diagnosed as early as possible and needs to be treated. Now, how can it be diagnosed? Diagnosis is majorly by RT-PCR, the test which is currently being used for diagnosing COVID-19. Similar test is performed for diagnosing H5N1 infection, and can then the treatment be followed. Now, when I talk about treatment, there are two things in it. One is infected person, how can it be treated? And non-infected person, how can he avoid being infected? Tamiflu. Tamiflu is one known remedy for this infection. Along with it, certain supplementary medicines could be given, but Tamiflu is known to treat bird flu. Mind well, the drugs used for treating common flu, influenza, is not to be used for treating bird flu. It may result in the complications. So, the commonly used drugs for influenza, that is amantadine or rimantadine, these are not to be used. See, the transmission of the disease is by exposure to the infected birds, that is handling them or being close to them, or by consuming the poultry meat which is not properly cooked. So undercooked or uncooked poultry meat from the infected birds can transmit this disease to humans. Human to human transmission, as I said, is not so commonly known. So prevention is possible, treatment is also possible, but the fatality rate is relatively high. So we need to take appropriate care and avoid being exposed to any such infection. Remember, when I talk about prevention, the mode of transmission is from birds to humans. So open air markets, open air poultry markets should be avoided. Contact with the infected birds should be totally avoided. And consumption of undercooked or uncooked meat should be avoided as far as possible, particularly if the poultry farm has the possibility of infected birds being there. So proper hygiene, proper care, sanitization, these are the measures which would help in avoiding the infection or preventing, or that is how we can stay away from H5N1. The other zoonotic disease that I would talk about is anthrax, which is caused by a bacterial strain called Bacillus anthracis. Bacillus, as you must be knowing, it's a rod-shaped bacterial strain. So Bacillus anthracis can lead to anthrax. Now, uniqueness about this bacterium is it can form spores which are highly resistant. When I say highly resistant, these spores can withstand absolutely dry conditions. We can put them in a container and keep them aside for a long while and they would stay dormant for all that span of time. So dormant spores are possible which are highly resistant, and the transmission of this pathogenic disease is by contact with the herbivores. Herbivores, that is, could be sheep, goat, buffaloes, cows, which have been infected. That is livestock. And through that contact, or maybe my consumption of undercooked food, undercooked meat, that contains the pathogen, it can be transmitted to humans. Human to human transmission is not that commonly known. There are 4 ways in which the infection can happen in an individual. These are skin infection, that is cutaneous, respiratory, could be pulmonary, gastrointestinal, that is in the digestive tract, intestine particularly, or through injections. These are 4 ways in which the infection can happen. If I talk about cutaneous infection, symptoms maybe particularly, which is called as Hyde-Porter's disease. Here skin lesions, skin edema, skin reddening can happen with a centrally positioned black, maybe kind of depression or a patch, or it's a kind of a necrotic ulceration that occurs in the center. This point is identified as Ashar, the central black thing that happens. It's named as Ashar. Now, Ashar forms a center around which the skin has reddening or swelling or maybe edematous formation. Respiratory infection, if we talk about, there can be cold or flu-like symptoms, there could be headache, there could be mild fever, chest discomfort could be there, pneumonia-like symptoms may occur, and in extreme cases there could be respiratory failure leading to death. Gastrointestinal infection, if we talk about, that is generally caused by intake of undercooked infected meat. Here it could be nausea, vomiting of blood, abdominal tenderness or abdominal pain, severe diarrhea, it could be bloody diarrhea at times, loss of appetite, inflamed intestine, and this also can lead to death, though not as common as in the respiratory infection. And injection kind of infection, if we talk about, it is caused by use of syringes or needles from an infected person to a healthy person. Then it can be transmitted. And the symptoms would include or would be indicated depending upon which organ has been affected by the injection. If it's a superficial injection, then it could be similar to cutaneous anthrax. Or if it's injected deep, then whatever organ is involved, inflammation of that organ and related complications can happen. Related in the sense, the organ which is involved in it, related complications can happen. Inflammation, abscess formation, in extreme cases there could be organ failure or death. Not common but not unknown as well. Now, treatment is possible by use of ciprofloxacin, levofloxacin, doxycycline, or maybe a combination of them. Prevention is quite possible by avoiding exposure or contact with the infected animals, infected livestock, consumption of properly cooked meat, avoiding undercooked food, and maintaining appropriate hygiene. That can help in preventing the infection of anthrax. The next disease I would discuss is rabies, caused by Lissa virus. Lissa virus, rabies virus or Lissa virus, you can say. It is spread through scratching or biting by an infected animal, from animal to humans, or animal to other animals also. It can be transmitted through bites or scratches. Commonly, dogs are known to be responsible for this kind of transmission to humans. contact of eye, nose, mouth with the saliva of the infected animal also can be responsible for transmission of the disease to humans. The virus travels through nerve fibers. Wherever the bite is there or scratching is there, from there the virus enters the nerve fibers and travels towards the central nervous system. So, uniqueness about this pathogen is it is not carried through blood or lymph, it is carried through nerve fibers. So, the symptoms would be basically related to the disorders in the central nervous system. First thing that we must remember, rabies, once developed, it is almost impossible to cure because it is affecting the nervous system. So, from the site of infection till central nervous system, as I said, it travels through the nervous system, it travels through the nerve fibers, and once inside the brain, it leads to, first of all, it leads to acute inflammation of brain, nervous tissue. Later on, there could be fever, tingling at the site of the infection, confusion, violent sudden movements, inability to move some part of the body. There could be hydrophobia, that is fear of water. The patient, if it sees water, it starts showing sudden movements which are unpredictable, which are not possible to be explained on any other basis. So hydrophobia is seen, consciousness could be lost, and finally there's death. See, from infection to appearance of symptoms, there could be a span of a few weeks to a few months, at times even a year. And this span depends upon the time the virus needs for moving from the site of infection till brain, till central nervous system. That will decide how much span would be there. Vaccination of animals is possible and it is recommended. So pet animals or the animals which we are likely to come in contact with, they are prescribed to be appropriately vaccinated. And immunizing the high risk people. High risk people are those which have to work with pets or animals. That is veterinary doctors or other pet keepers, whoever are likely to be exposed to this kind of pathogenic invasion, they are recommended to be duly immunized. Survival rate of rabies is very, very low. Almost fatality is assured. And the treatment, at the most, it could be washing the wound with disinfectants or cleaning it to the maximum possible extent. This minimizes the viral or the load of the pathogen. So, maybe the immunity would take care of the rest, but otherwise there is no assured treatment possible for this kind of infection. So rabies is always said it is 100% fatal. So prevent it, avoid it, treatment is almost not possible. That is about rabies. Then let's talk about toxoplasmosis, a pathogenic invasion caused by toxoplasmosis gondii. That's the name of the pathogen. The parasite stays in cats and can be transmitted from cats to humans through certain cysts. Cysts are ingested through feces. And unhygienic food habits, that is, if houseflies could be there or other carriers could be there, which may transmit the pathogen from the cat feces to human food or water, and then it can be ingested and can lead to toxoplasmosis. Transplacental transmission is also possible, but if the mother is infected, the child could get infected, the fetus could get infected. And very rarely this has also been known to be transmitted through blood transfusion. Rare phenomenon, but not absolutely unknown. Now there are two types of it. One that we can call as acute toxoplasmosis, that is immediately after infection. See, in adults the immunity is relatively higher, so toxoplasmosis may not show any specific symptoms as such. But otherwise, if the immunity is not able to take care of the pathogen, then the symptoms could be flu-like. That is, some feverish condition could be there, headache could be there, muscle aches are there, tenderness of lymph nodes could be developed, eye problems could appear like blur vision, retinal inflammation, and people with weaker immunity are more likely to catch up this infection. Whereas the latent toxoplasmosis, that is wherein the cysts are formed in the tissues. The pathogen enters or travels up to the tissue and then it forms the cyst. Then depending upon the location of the cyst, accordingly the infections can appear. That is, there could be lesions of retina, lesions of alveoli, lesions of heart, skeletal muscles, or central nervous system. But in central nervous system, the cyst stay for a longer span of time. Persistent cysts are formed there. And the treatment would involve administering drugs like pyrimethamine or sulfadizine or syndamycin or spiramycin, or maybe a combination or a varied combination of these drugs. For latent infection, the earlier drugs which I mentioned, they are applicable to acute infection. Latent infection can be treated with
Atrovaclone and clindamycin, or a combination of the two.
Transmission of this disease is that way very rare. So prevention could be by appropriate hygienic food habits, or maintaining the pets appropriately, avoiding transmission of this kind of pathogen from the feces to maybe food or water. This is quite possible. So prevention is possible, treatment is also possible, but finally it's a disease. It's going to cause some complications in the body. So let's keep this away from us. I'm sure you like the videos, so don't forget to like them, subscribe to them, share amongst your friends and family, and do post your queries or suggestions or recommendations, or if you want to know something more, don't forget to post your queries. Thank you.